Good afternoon and welcome to the third and final day of the 2021 State Flex Program Virtual Reverse Site Visit. We are glad that you are here and we hope that your time during the conference has proved fruitful and you've learned something that maybe you didn't know before or that you can take home to your states to better improve your programs. So we are very excited that you've been a part of this. Your feedback has been phenomenal. The comments that you've shared with your peers and us has been invaluable to how we're going to move forward. So please continue to keep that up. If you should run into any technical issues on the main attendee hub page on the right side of the screen, there is an email and a phone number that you can use to reach out to the CVent Tech Support team. That phone number is 877-563-0031, and the email is nrhrcsupport@cvent.com. As a reminder, all of our sessions are recorded and they will be available for playback on the Attendee Hub about 30 minutes or so after each session ends. So if you miss a breakout session or if you have to cut out a little early, you can always come back and rewatch the rest of the show. Now, you are automatically muted during these main plenary sessions, but there is a chat box on the right side of your screen. It says chat, and there's also a Q&A box there as well. So feel free to put your comments and questions in the appropriate boxes, and we will get to you as quickly as possible. Now, at this time, it is my pleasure and honor to bring in some people from the federal office and who are great partners who have helped make this event a success as well. And we will start with Natalia Vargas.
Thanks, Natalia. And I'm happy to be here today to have the opportunity to be a part of this award celebration, recognizing the hard work that you've accomplished during this past year in the area of quality improvement. The Hospital State Division works to enhance access to quality care by supporting states with resources to strengthen the rural health infrastructure. And I'd like to thank all of you State Flex Program coordinators, all the subcontractors that work on MBQIP for all of your hard work, thoughtfulness, and commitment during these challenging COVID pandemic times to help us meet the goals of our Hospital State Division programs and MBQIP, and to ensure that critical access hospitals continue to deliver high quality care for their rural communities. I'd also like to thank Natalia for her leadership navigating our strategy for this past year, working in collaboration with the great team, the Arkita team at Stratus, to see what we can do to kind of adapt to the environment that we're in now. And it's also hard to believe this past year we had this switch, kind of unanticipated switch to the quarterly reporting process for the MBQIP data. And so appreciate Natalia and the work that Megan Lair had at the Flex Monitoring team to make that switch and then work to enhance those projects in collaboration with Arkita as well to make those reports more usable for you and your hospitals. As we move forward, we know the pandemic continues to evolve and that our HSD programs must continue to evolve as well so that we can continue to meet the needs and sustain our commitments to high quality care for all patients. Unfortunately, we've made progress in our efforts to help hospitals continue to report quality measures, and the awards today demonstrate that despite these challenges, that you and your Flex programs have continued to work hard to engage your hospitals in meeting the quality improvement goals. And working together has really been an instrumental part of our ability to come this far. This approach is consistent with and really goes to the core of HRSA's mission as well, just constantly striving to improve health outcomes through access to quality services. And we can't do this work without the work that all of you are doing with your rural hospitals. The road to improvement has many lanes, and today we're honoring specific individuals from the selected states, but we know that the path to achievement has involved a lot of folks who have worked tirelessly to get this work done. And so this recognition reminds us of the important collective efforts that are involved in this project and that everyone has an important role in the achieved success being recognized today. So I'd like to encourage all of you to continue to work together and would like to extend warm congratulations to all of those that are recognized today. So with that, I'll turn it back to you, Natalia.
Thank you, Kristi, for those nice words. And that is a really great setup for the next part of our presentation today. We are going to be presenting recognition to the states that won this year's Spirit Awards. So it is such a pleasure every year to present these awards, and it just makes me so happy to really think back of all of the things that you all have done to really set yourselves apart, and really improve care for the communities that you serve in your own states. So next, I would like to present the first awardee. I'm so proud. The MBQIP Spirit Award, the first award, is being presented to the state of Texas. So we're so proud of you guys for all of the work that you have done. And if we were here in person, we would hand you this shiny award. So you get this one-dimensional one today, but that is not to say that all of the efforts are discounted. So we definitely are so proud for all of the work that Texas has done in their Flex program this past year. And the award recipient in the next slide that I want to talk about is Robert Shaw. So with Robert, he's particularly my own grantee, so I'm very proud of him. So he provided this short statement, but it just shows to you all the passion that he brings to the work. And in the past year, I've had the privilege to see him grow in this role tremendously, and just so proud of Robert and the team in Texas. So congratulations, Texas. And to the next awardee that we'll be presenting today, this award goes to New Hampshire. So again, if we were in person, we would warmly hug you and congratulate you in person. But again, we're so happy that you're joining us today for recognizing New Hampshire. So the awardee receiving this award is Alia Hayes. Excuse me. So in this slide, you can see she really wanted to bring the flavor of collaboration that happens in New Hampshire that really sets them apart. In particular, with the quality improvement efforts that a lot of folks have taken a part in doing in the past year. And so they have very innovative, creative ideas that they work in partnership with the hospitals. So definitely that hospital engagement piece is something that we've had the pleasure to see bloom in the past year. And so we really acknowledge that piece in New Hampshire. So congratulations, New Hampshire. The next awardee that we have today is Arizona. So again, this year has been so wonderful, and many of you have done tremendous efforts in your own states. And we're so happy that, we have seen Arizona really, again, grow into that role of supporting their hospitals. So we would like to recognize those efforts this year and congratulate Arizona. Receiving the award is Jill Bullock. And as you can see, Jill brings a lot of passion to this role as well. She has specifically worked so hard with engagement of the tribal hospitals, and we're incredibly proud of the work that they're doing to make sure that these hospitals are, a strong part of the Flex program, integrated into all of the support systems that are offered by Arizona. So congratulations, Jill, for such a wonderful job this year. And next, we will be presenting the MBQIP Performance Award. So 10 of you always are recognized every year by ranking of all of the states. And if you're interested in that methodology, we've definitely published that and made that accessible. So just send us an email if you're interested. But this next part of the presentation, we're actually going to be watching a little bit of what they do and basically what makes their work so meaningful. So each of them had an opportunity to speak to our team and tell us a little bit about what they do in their states that makes them really proud. So in this next part of the presentation, we're going to be watching a short video, and I will kick it back to the production team to show us that video.
Virtual greetings. My name is Clarissa and I'm the Rural Health Manager at the Virginia State Office of Rural Health. Our state office is a mighty team of 4 led by Heather Anderson, and I oversee our rural hospital programs. I am humbled and honored to be accepting this MBQIP QI award on behalf of our rural hospitals who have gone above and beyond the call of duty throughout this entire pandemic. This year's conference theme of rural resilience really aligned with our annual Rural Hospital Coaching Collaborative, which centered around improving communications through challenging times. So we partner with our hospital association to annually assess the patient safety and quality needs of our hospitals, and we take that information and create program offerings for those who want to participate. So this year we had 14 out of 20 rural hospitals participating, including our critical access and those who are SHIP eligible. This year's collaborative included free registration to our annual Patient Safety Summit, virtual leadership workshops with Studer Group, one-on-one hospital coaching calls, peer-to-peer networking, and we also facilitated learning tracks. So that included building your quality bench, how to recruit frontline staff, servant leadership, and culture of safety. And our partner at the Hospital Association wanted to send a shout out and a congratulations to our hospitals.
Good afternoon, I'm Joyce Davalt, and I'm the Director of Performance Improvement at the Virginia Hospital and Healthcare Association. We have offered multiple educational resources to support the quality work that our hospitals have been doing, and it is evidenced by your commitment that you have received this award from HRSA. I'm very proud of your outstanding service and congratulations on this honor, and especially during a very difficult year with COVID. Thank you.
So I'm immensely proud of our hospitals who throughout this pandemic have always put the needs of their patients and communities first, and they continue to do so. And I'd also like to thank HRSA for recognizing the work of our facilities. We hope everyone has a great rest of their conference.
Hi everyone, I'm Britton Herbert with the South Carolina Office of Rural Health. I work heavily on our state's MBQIP efforts along with Sarah Craig, our state flex coordinator. Last year, for the first time, South Carolina ranked in the top 10 for these acknowledgements. We were number 2, and I was incredibly proud of our cause. When I told one of the CAW abstractors that South Carolina had ranked 2nd, the first thing she said was, "I guess next year we'll have to be number 1. Honestly, I smiled and chuckled at her enthusiasm, but then they actually went and did it. In recent years, we've had a focus on increasing our regular reporting percentage through continuous communication, and reporting percentages have consistently been on the rise, and so has the data being reported. The internal drive of the quality programs within these CAWs and the camaraderie amongst them is commendable. We're a small state when it comes to our number of CAWs. We presently only have 4. But even within the small amount, they range from independent to system managed, nonprofit to county-owned, and quality departments of a single focused team of abstractors to a single individual with many focuses. But despite the differences, they still come together and freely share information with one another, struggles and successes, areas of opportunity and of being overwhelmed. The group recognized their differences, but also their ultimate similarity of providing top-notch quality care to rural South Carolina. As we move into the Flex QI project with the upcoming Flex Performance Year, their excitement and drive is palpable, and I cannot wait to see what the future may hold for this group.
Hello everybody, greetings from Nebraska. I'm so excited today to be able to accept this recognition for the work that our quality improvement staff have been doing. They have been working so hard, even with COVID and all that came along with it. They never lost sight of their MBQIP goals, and this shows it. I want to thank the Federal Office of Rural Health Policy for making these recognitions. It means a lot to us. I can't wait to go back home and tell everyone all about it. Have a great conference, everybody.
Hi, I'm Doreen Hutchinson, and I am the CNO as well as the VP of Patient Care at Fairview Hospital in the state of Massachusetts. And I'm here to really talk briefly about bringing in a consultant that our state office, our FLEX program in the state office, helped all 3 critical access hospitals. We decided that we all were going to focus on the ED throughput program here. And so I want to introduce you to Dr. Adrian Elliott, who is the chief of our emergency department, and he basically is the person who ran the team.
We were very lucky to have a consultant come in, Ms. Carla Wilbur, and really look through all of the different factors that go into throughput. We realized that this was not just an emergency department problem, really a hospital-wide problem. And so what we were able to do was bring all of the stakeholders together, whether it be the inpatient side, the emergency department, even environmental services, to make sure that we could find out what is needed to shorten our times. We were able to set up programs like a ready bed, a ready nurse, and even move med reconciliation out of the emergency department to the inpatient department, where it can be done without the time constraints of moving somebody upstairs. So it was really a very helpful program.
Right, and it really made it better for patients that they could get moved quickly and get into bed. And we think that it was great, and we appreciate the support that we got to do this.
It has been a really exciting year for the Utah Flex program, specifically the quality improvement program area. Beginning late last year, we began working with the state QIO, Co-Imagine Health, in order to develop a program to provide technical assistance, one-on-one technical assistance to our critical access hospitals in quality improvement. And so in order to, kind of got to a rocky start because of COVID, but once we got past the first vaccination wave, they were able to really hit the ground running. Co-Imagine Health performed an assessment of all of the critical access hospitals in order to identify knowledge gaps in quality improvement concepts and principles. And then they were able to take what they learned from the assessment, and develop a curriculum for a 6-session ECHO series on quality improvement available to all of the critical access hospitals. In addition to the ECHO session, they also used that information to provide targeted one-on-one TA to the hospitals. And so through the course of these ECHO sessions and through the one-on-one TA, 2 hospitals have already implemented improvement programs addressing long-term medications and medication errors. And both of them anecdotally have seen a lot of success in those projects. And we're very excited about this, to see this work continue forward and to see some of the data as it comes out to show the success of these projects. We're really looking forward to that over the coming year, and to continuing to see the hospitals improve in the years to come. Thank you.
We are so honored to be in the top 10 for the 5th year in a row. We are so proud of our hospitals and the quality level of care they provide, and their dedication to submitting measures. Wisconsin has been a leader in quality for quite some time, and this is in large part due to a culture that was put into place years ago, and that's one of transparency, one of doing the right thing, and using data to tell your story. Some of you are familiar with my personal story with a critical access hospital and my son, but I think it bears repeating here to demonstrate the quality level of care I've experienced personally and seen professionally in critical access hospitals. So this was quite some years ago that I took my son into the ER, and he was having an asthma attack, and it was pretty bad. They took great care of him. It was awesome, the experience that I had, and they sent us home. Well, as the night went on, the asthma came back, and it got worse. So I was up all night, no sleep. Took him back to the ER in the morning, and I'm carrying him in, both of us crying hysterically, and he's struggling to breathe. So they took him back right away. They provided him great care, and as things settled down, the nurse said to me, "Have you eaten? I said, no, I haven't eaten, I haven't slept, I don't know what to do. She said, let's get you a tray of food from the cafeteria. And I was astounded. It never occurred to me that I was kind of a patient here too. She said, you need to take care of yourself before you can take care of him. And I've always remembered that. It's always been close to my heart. So thank you once again for this honor. This is great. That whole experience happened to me before I even got this job. And it's some cosmic thing that brought me to critical access hospitals and combined that personal touch, that personal experience with the skills I developed professionally. So thank you. It's an honor.
Hello. The Michigan Flex program is proud to be a top 10 state for MBQIP performance and reporting this year, and since inception of the awards in 2017. The strength of the quality component of the Michigan Flex program can be directly attributed to the support provided by the Michigan Critical Access Hospital Quality Network. This impressive network of CAH quality leaders truly support and empower each other to provide high-quality, patient-centered care in their respective communities. All Michigan CAHs are members of this network. They meet on a quarterly basis to benchmark key clinical data, present on best practices, and share safety stories. The group is led by a 12-person executive committee, and I'm pleased to have President Mariah Hess here with me to share in this award.
Thank you, Crystal. Definitely the network could not be where it is today without the Michigan Center of Rural Health, so thank you. But it is amazing to work with all 37 critical access hospitals in the state of Michigan, how we share and learn from each other every day, not just at our quarterly meetings, through our listserv, through our contacts and our relationships that are strong to help us provide the excellent, exceptional care in the critical access hospitals. We've come a long ways through our reporting, our process improvement, and our transparency. And I am so proud to be part of this network. And our motto is, no critical access hospital left behind in Michigan. So thank you.
Thank you, Mariah. And thank you to HRSA and the Federal Office of Rural Health Policy for recognizing Michigan critical access hospitals as they continue to provide exceptional health care for their rural communities.
I'm Brad Gibbons. I'm the Director of the Center for Rural Health at the University of North Dakota. We are very, very proud that North Dakota is ranked 6th on quality indicators that are related to MBQIP. We are thrilled for our providers. They work so hard. They have done so much work over the years. The credit in many ways goes to our North Dakota Quality Network. This is a network of all 36 critical access hospitals. Every single one of them participate. They share information, they talk to each other, they listen to each other, they encourage each other. Really, this is very much a group effort for North Dakota, and it's really because of the hospitals. We created a platform in the network, but the network really belongs to the hospitals and the directors of nursing and the hospital CEOs and all the people who participate in this. So that's what makes the difference in North Dakota. North Dakota, in many ways, is we do it together. It's not a single operation, and that is how we achieve what we achieve in the state. So we are very, very proud of this, and compliments to all of our providers.
Thank you. Thank you. Thank you.
Thank you.
Thank you. Thank you.
Hello everyone, I'm Dawn Walter, the Flex Coordinator in Georgia. In our MBQIP program, I am most proud of the initiatives we've developed to support our critical access hospitals in consistent reporting and quality improvement. Many factors can derail data submission or the accuracy of data submitted. Staff turnover and insufficient or lack of training were identified as our most common factors. The surge of COVID patients and the need for all hands on deck have been another big factor. So we developed initiatives to address these factors that support our cause through education, technical assistance, peer support, and accountability. With our partner, the Georgia Hospital Association, we keep an open line of communications with our hospitals to quickly identify staff turnover or areas of educational opportunity. We developed a quality professional orientation that is basically an MBQIP 101 to educate and support new staff that traditionally feel overwhelmed in their new QI roles. Our mentorship program pairs our seasoned quality professionals with new or less experienced professionals. And for additional networking support, we host a professional monthly mingle where CAWs can network, share best practices, and participate in an open Q&A on any relevant topic. The support and accountability developed through these initiatives has proven to be successful in our CAWs achieving the number 7 ranking nationally. We are very proud of their hard work and the resiliency they've shown in their commitment to quality improvement in the midst of battling the pandemic. We also appreciate the resources and technical assistance provided by TASC, Stratus Health, and the federal office. Thank you.
Well, I don't know about you, but that video just took my breath away. So I really hope that you enjoyed today's program. It is such an honor to hear from all of you, especially if you share your stories. That really brings meaning to the work that we do. And especially as your MBQIP coordinator, I can say that I'm so proud of everyone that put their time and effort into sharing your story. We so appreciate that, and we hope that it was enriching for everyone else to see. But before we move forward, I would like to recognize that New York was part of the MBQIP Performance Awards this year, and they could not join us for the video. But we would still like to honor them today and recognize their efforts in MBQIP performance. So with that, I would like to bring us to a close of the session and would really like to thank everyone, really, whether you're recognized today or not. We definitely see how hard you're working. And, these are times that are very difficult and require very creative thinking. So as I've mentioned in previous presentations, this is collaborative work, and we couldn't do this without all of you guys. So I really see you all as partners to our Federal Office of Rural Health Policy. And that brings a lot of meaning to the work that we do at the federal level, just to see each of the states grow in their own capacity and their own ways to engage hospitals to really make this work happen. We couldn't be more proud of this group of grantees. And we would like to just end today with letting you know that this recognition is well-deserved, and we would just like to congratulate everyone. So thank you, and enjoy the rest of the reverse site visit.
All right. Well, that was fun at the beginning. Thank you for hanging on with us through the little technical glitches. We're glad that you stuck it out. We are very happy to be a part of this program and the MBQIP Awards, and just it's amazing to see, like Natalia and Kristi both said, the hard work and the efforts that people are putting in. And so don't ever forget the difference that you're making in the lives of people that you may never meet. And so keep that in mind. So at this time, we will wrap it up. We are going to go into the Small Rural Hospital Blueprint for Performance Excellence and Value with Caleb and Terry. There should be a link in the chat that just got posted. If you can't get that link, just go back to the main Attendee Hub page, and it will be the top option right there at the beginning. Thank you again for being here. Thanks again to all the award winners and to the Federal Office of Rural Health Policy. And we will see you guys shortly in the other room. Thanks.